Well, July is Minority Mental Health Awareness Month. The focus is to address how a person's background and identity can make access to treatment even more challenging. Eyewitness News reporter Sharon Ko has more on how some San Antonio groups are trying to fix this problem.
There are disparities within minority mental health care. According to the Substance Abuse and Mental Health Services Administration, more than 70% of African American adolescents with a major depressive episode did not get treatment. Asian American adults were less likely to use mental health services than any other ethnic group, and nearly 25% of adolescents with a major depressive episode in the last year were Hispanic. NAMI San Antonio has free mental health education classes, and the staff is prepared to help everyone get proper care.
English is not your first language, then trying to understand the just huge amount of information around mental health care and treatment can be really, really difficult. So locally, what we try to do at NAMI San Antonio is we have bilingual staff that can talk with folks that call in so that they're comfortable in their own language. And then we have training for our teachers so that we can have bilingual teachers trained.
The San Antonio Clubhouse is another place adults with a mental illness can get help. The organization provides job opportunities and creates a community where people can thrive.
A lot of times we're talking about employment and how we can kind of, cater to the demographic that wants to go out and seek work. And we do so by, again, working programs that allow the members to continue to collaborate and build that confidence.
While these two groups are helpful resources, as healthcare providers can also join in the fight.
One of the most important things for mental health providers is just to ask, what's going on. Ask questions about traditions and culture of the person that's, beginning to inquire about services.
Sharon Ko, KENS 5, Eyewitness News.